this opportunity to brief all of you on some of the difficult challenges we inherited as government, and not to lament or complain, but to tell you what we have done about those challenges. I know that the public interest in the issues of health is very high. Rightly so, because it is very essential for our survival. Ladies and gentlemen, in January 2025, when we took office as government, in the Ministry of Health, we inherited a situation where about 13,500 nurses and midwives had been recruited and posted without financial clearance, without any provision to pay them. In fact, the financial clearance with respect to the 13,500 nurses and midwives expired on 31st December 2024. What it means is that when a financial clearance is issued, you must necessarily migrate the health professionals onto the payroll before the expiration of the clearance, for the financial clearance. So, if it expires, what it means is that there is no financial provision for these people. This is a fact. And so we had two options as government. Whether to let all the 13,500 nurses and midwives go home, whilst we look for the financial provision, we look for money. And issuing clearance is not just for issuing sake. Once you are issuing the clearance, you must be ready to pay them. And so the first option was to allow all of them to go home, whilst we look at how we can get money to call them back. And so if you remember, it was a topical issue when we took office that we're going to sack some health professionals. So some of the associations even reacted to this. And the second option was to allow them to continue to work whilst we look at how we can get money to pay them. And I'm talking about 13,500 nurses and midwives. So as government, we chose the latter. Because we cannot allow the 13,500 people to go home and add on to the over 74,000 health professionals who have already been trained and they are at home. And to tell you the truth, I have never regretted that we chose the option of allowing them to work and finding ways to pay them. When we chose that option, we didn't go to sleep. This is what we have done. Out of the about 13,500, as I speak to you, about 7,000 out of the 13,500 are being paid, they are on the payroll, and they are being paid. Here, let me further explain that in actual fact, those that we have succeeded in putting them on the payroll are about 10,000. But out of the 10,000, 7,000 of them are being paid, and 3,000 though on the payroll, but they are not being paid. So you hear situations like, yes, I am on the payroll, but I'm not being paid. That is why I'm giving you this explanation. So 7,000 are being paid. Ladies and gentlemen, issues of salaries and monuments. As a ministry, we must necessarily collaborate with the Ministry of Finance. We cannot do it alone. And so we had an outstanding of 6,500 nurses and midwives whilst we were taking steps to onboard all these people onto the payroll and get them paid. So don't forget, out of the 10,000, some 3,000 have not been paid, and about 3,500 have also not been put on the payroll at all. So making 6,500. Especially so when that was not the only difficult situation we inherited. So anytime you go to the Ministry of Finance, it is about putting another weight on the public purse. I'll give you examples. We have health professionals who had completed their housemanship, and some of them doing their housemanship without clearance in 2024. So we successfully collaborated with the Ministry of Finance to get about 883 of these officers getting clearance so that they can get their allowances. You recently had some junior doctors threatening to go on strike. They have started work without clearance, without salaries, without pay. Again, we collaborated with the Ministry of Finance, and as I speak to you now, we have succeeded in getting them clearance, and they are being migrated onto the payroll. We had about 800 medical doctors who had finished their housemanship, but they were still at home without clearance. As I speak to you now, the Ministry of Finance has issued clearance, and all these medical doctors are going to start work with immediate effect. And with this one, our priority areas are in the rural areas. So it was not only the issue of the 13,500 nurses and midwives. There were pharmacists who had completed their housemanship as far back from 2023 to 2024 who had not been paid. We inherited that. And those people have been paid. I am telling you what we inherited and what we have done about them and what we are doing about them. We had more than 17,000 rotational nurses, allied health professionals who also didn't have clearance as far as their rotation was concerned. By the grace of God, we have secured clearance for these more than 17,000 health professionals. That was not the only thing. There were issues about conditions of service. You've heard them before. And so we had to onboard them gradually, because you agree with me that we also have a country to govern. Ladies and gentlemen, as I speak to you now, that about 6,500, that will add up to the 7,000 already being paid, making 13,500. That allowance, that's over 6,000. Cabinet has approved that with immediate effect, starting from November, the Minister for Finance must pay them. And I have in my hand the letter to that effect. And so these were the difficulties. I empathize with anybody who had to go through this painful situation. And it is important for Ghanaians to be taken along. And so I think at this point, I will want to pause here. If you have any clarity to seek, I will do that accordingly. I thank you for the opportunity.